Okay, this is the first time I'm actually doing this. Giving it a try here. I'm really hoping that this adds a lot of value. So basically, we're going to talk about teeth grinding. I want to know, are you experiencing any kind of sore jaws or headaches or earaches, perhaps, or your spouse or partner hearing anything at nighttime, some funny noises? If that's the case, then this video is actually for you. So before I get into all that, I want to make sure that um, I covered a few things. One is I actually changed up the way I did some videos after taking a little time off on YouTube. So please have a look at my new videos. We're a little bit more entertaining, with me talking over some of the scenes versus me just kind of in the camera, looking kind of blah, just talking. So I'm hoping it's a little more entertaining, but also adds a lot of value. So take a look at some of my new videos, old videos, and then tell me if which ones you like. And then also too, if you think going live in this kind of structure will actually make a big difference for you as well. So all in all, let's kind of get into the topic here. So first thing is, what are some of the common signs that you're clenching or grinding your teeth? Well, one is you have morning headache, especially in this area right in here. You're just really sore. You got these headaches, almost like a tension headache, it seems like. Often too, people have earaches. It's a little ringing of the ears. It hurts a little bit, maybe right side, left side, could be both. Number three is actually one that people really don't notice unless you pay real close, conscious attention to it in the morning when you wake up, and that's when your jaws are a little tired and you do this number, right? Get it all stretched out. That's a real sure sign. And then when I ask people, they have no idea that they're clenching and grinding their teeth. They have no idea if they do that at all. You got to pay attention to it. So those three right there. Another thing you can actually do is feel your muscles in here. Are they sore? Take your finger kind of right on the top of your back teeth there, kind of push back there. If that's a little bit sore back there, there's a muscle. Um, but one thing that you can also do is you see how your teeth look like. Are they all chipped and wavy in the front? They have a little small little lines going down. They should be sharp, right? They should be sharp and not flat on the edge, especially the ones on bottom. So that is some common signs that you are clenching or grinding your teeth. What causes it? Well, really, it's the main source I have found and noticed is that it comes from stress. The stress in life is just overwhelming, right? Kids and family and money and work and all this stuff kind of going on. You got the anxiety that comes with it. You have a worrying about this, worrying about that. Your kids go to the park, you're worrying, whatever it may be, could be a stressor, right? Big one is really family. Um, no fear about something, losing your job, no losing a loved one, no fear of being alone. So a lot of those emotions that are tied into those main things are what the subconscious kind of hangs on to, what's feeding it, and that clenching, grinding starts to take place. Another thing that people may not be aware of is also the parasites. Got parasite infection that can actually cause a complete imbalance of all your hormones and your neurotransmitters, and actually cause the same thing that all those emotions will actually happen with teeth grinding. So how you know you got a parasite infection? It's really hard to tell, but that can actually be the case as well. So here are some things that can happen to your teeth, clenching and grinding. One, you're going to start cracking in your teeth. They're going to have little stress fractures. They're going to start breaking off. You're going to have crumbling teeth, especially if you have old silver fillings in the back. You're going to start realizing, my teeth just crumbled. I ate pudding. Well, the pudding didn't break that tooth. What has happened over time, that constant stress, abnormal stresses, use of that tooth, and abnormal behaviors broke that tooth. Of course, that big silver fill and the way it was constructed has something to do with it as well. But pudding didn't break the tooth. Your appearance of your teeth are going to look more wavy, going to look more grainy, look more flat. You're going to have more lines going through them, the little small fractures, vertical lines that go up and down on your front teeth. Those are what happen. That messes with your smile. And then if you had a lot of dental work done, your fillings will not last. Your crowns will not last. It's going to be worn and broken. So overall, I mean, your overall health can be drastically affected with just grinding of your teeth. What else can we get into? Well, let's talk about the test real quick, what you can do at home. One is a mirror test. Take a look. All you're going to simply do is pull your lip down, right? Tilt your head, and you're gonna look at the sharpness of your teeth. They should be pointed. If they're flat and you see almost like a two-tone color of white on the outside, darker yellow in the inside, that means your outer layer, your enamel has been worn down and you're clenching and grinding. Look at your front teeth up top. Are they wavy? Are they kind of chipped and fragile? Yeah, you may have hit yourself, 20 years ago drinking a soda pop or beer can. However, that is not the cause of the wavy smile you actually have. So that's number one. Number two, take a finger test. Take the finger back here, and you're gonna feel like a little muscle pushing that. If that's sore and tired, that's not tired, but if it's sore, clenching and grinding your teeth. The morning test, be conscious when you wake up this morning or next morning. See if you actually stretch your jaw out. And if you do, is it tired? Is it stiff? Is it sore? Another good sign that you're clenching, grinding your teeth. And then lastly, ask your spouse. Say, hey, look, I'm gonna go sleep tonight. If you hear me any kind of funny noises, please let me know. Now someone else will verify that you're actually clenching, grinding your teeth. So a lot of times, I'll say 99.9% of the time, people don't know if they're grinding their teeth. Some people do, don't want to admit it. Some people don't want to do anything about it. But most of the time, people just can't believe that they're clenching and grinding because it's something that never been told before, or even think it could be a bad thing, or perhaps things even normal. And it's not normal. It's actually become normalized. So here's some practical tips that you can actually do. One is, gotta stop stressing. I know it sounds simple and it's not easy, but that's what you got to do. You basically got to care about things in your life. But at the end of the day, you just really can't give a heck. You can use an F word, but you really can't give a heck. Because you care about it, but you got to let it kind of go. And depending on the different challenges in life, it gets more and more challenging, right? And you got to build that wherewithal, that skill to be able to handle that next level problem. But you really just can't give a F or a heck, all right? Yeah. So with that being said, if you come back positive with those little self-tests, you see the signs, you have the symptoms, it's really important to actually go see a health professional, a dentist, because there's some things you can actually do if you can't correct yourself at home with the stress reductions or worry reductions, being afraid and that goes away. It's really about protecting them. And how you do that is by going to the dentist, having the oral examination, talk about your concerns, and ultimately get the solution, which is a professional fitting night guard. Those are the best because they're custom molded to your teeth. It's like ice on ice skates. Your teeth are going to glide over, and you're going to avoid the inner locking, which causes all the problem. Now, you could, as a stopgap measure, not a long-term solution, you can go to any pharmacy, and I call them El Cheapo because that's exactly what they are. 20, 30 bucks. They don't last that long. They're not as good, but at least you're not putting your teeth on teeth, grinding and causing all those problems. But at the very, very end of the day, make the investment in yourself, right? Make the investment in yourself to get that proper oral appliance or the night guard to solve your problems. All right. So I really hope you enjoyed more of this lifestyle video. In the future, I'll schedule more in advance. We can have more people on board. But even if you watch this on replay, please let me know your thoughts about if this will be actually informative. Maybe tell me what topics are really important to you. And perhaps we can even get enough people on board. We can actually do more of like a Q&A style where we're going to chat. I just answer your questions. It's almost like going to the dentist, but on YouTube, right? Well, awesome. Thanks for watching the video. We'll see you next time.